fazer o sorteio da Premier, gente? Mais uma vez, né, agradecer a parceria da Premier, Pet Care, no VetCare. Está sendo muito bacana. E vamos fazer o sorteio.
Bom dia. Eu queria agradecer ao Pet Care pela oportunidade, agradecer vocês pela presença, e então vamos ao sorteio. São 10. São 10 mesmo? (1448) 1408, 1435, 1432, 1471, 1434, 1470, 1454, 1447 e 1451. Muito obrigada. Obrigada, Carla.
Eu acho que você vai ter, talvez, que repetir. Desses dois? Alguém vai ter que ficar com o microfone. Vocês vão ter que ficar com o microfone para cima e para baixo.
Tá. É um só. Acho que você. Não, fica com você. Pessoal, eu vou repetir os números, tá? 1470, 1447, 1454, 1471, 1432, 1435, 1451 e 1448.
We start at 11:15 and we go to 12:30. Gente, eu só queria comunicar que a nossa unidade oncológica de radioterapia começou a funcionar. Então, já fazem cerca de 25 dias que nós começamos a tratar animais oncológicos com radioterapia. Se vocês tiverem algum caso para encaminhar ou dúvidas, vocês entram em contato com radioterapia@petcare.com.br. Podem também mandar mensagem pelo VetWeCare ou falar com a Nil, ou então manda um e-mail para mim, para carla@petcare.com.br, que eu ajudo a fazer o redirecionamento do caso. A doutora Fernanda vai fazer uma breve apresentação sobre o Dr. James, e aí a gente já dá início à segunda parte da palestra.
Bom, o professor James Anthony, ele é diplomado tanto pelo Colégio Americano quanto pelo Colégio Europeu de Odontologia Veterinária. Ele foi professor da Universidade de Saskatchewan, no Canadá. Atualmente, ele não dá mais aula lá, né? Ele está aposentado. Ele está praticamente se aposentando completamente. Ele está montando uma vinícola no Canadá. Ele mora em Vancouver, tem uma fazenda em Princeton, onde ele está montando a vinícola. Provavelmente, no próximo ano, ele tenha já a primeira garrafa de vinho dele. Ele trabalhou durante vários anos na Califórnia, em Los Angeles. Acho que ele já deu aula em praticamente todas as universidades do Canadá. Ele trabalha no Animal Center, que é um hospital, uma clínica em Saskatoon, onde tem a Universidade de Saskatchewan. Ele trabalha alguns dias, uns 5 dias a cada 2 meses, então eles marcam todos os casos de odontologia para ele ir lá fazer. E ele é o responsável pela odontologia no hospital que chama Red Bank Veterinary Hospital, que é em New Jersey. É o maior hospital particular do mundo. E ele, uma semana por mês, ele trabalha nesse hospital. Então, ele voa do Canadá e trabalha essa semana inteira lá no hospital, que é onde eu tenho a oportunidade de acompanhá-lo. Ele tem, sem dúvida, uma vasta experiência, já fez parte do Colégio Americano, do Veterinary Oral Health Council, que é o conselho que tem a validação de selo dos produtos que comprovadamente têm efeito odontológico, né? E é uma pessoa extremamente didática. Acho que a gente tem que aproveitar o máximo da presença dele aqui, e eu vou pedir para vocês a participação de vocês, porque é para ser uma palestra bem interativa. E vai ser muito boa, muito elucidativa, se vocês participarem. Então, não tenham vergonha de falar, participem. A gente vai ter algumas pessoas com os microfones para você fazendo as perguntas, então respondam, tá? Participem.
Thank you, Fernanda, even though I didn't understand a word other than James. So today's lecture is going to be a little bit different than what we normally get in lectures, because it's going to be very interactive. So what I want to do is get your participation. And please don't be afraid to ask questions and say, what is this? I'm not sure what this is. Why do you say that that is happening? Because this is how we all learn. Because sometimes you will give me questions that I never thought of. And I can learn as well. So it's very interactive this way. This way we can maximize your learning capabilities here. And as a result, you will only get out what you put in. So please, please participate. So what I'm going to be doing is showing you a picture of a live animal, and then I'm going to ask you what you see on that. And then we're going to be taking a picture of the radiographs, and then I'm going to say, what do you see on the radiograph? And then we'll ask you to put it both together and come to a diagnosis or a differential diagnosis. and I'll tell you what we do for treatment and how it was, successful or not. So this way we'll be covering a lot of ground very quickly, okay? So please feel free to ask questions if you're really a shy person and you want to ask questions at a later date. You could always email me, and you have my email at the very bottom there. My Pacific Dental Service for Animals Limited is my personal company, and that's where I do wherever I work, I use the company, because Canada is very high in tax on personal, so corporations are cheaper, so I want to make some more money sometimes. You will see me walking around the room. I'm a walker. I need some exercise to lose some weight. And also, it helps me when people are falling asleep to ask them questions, okay? So I'll be walking around the room and listening to your questions. We should have a runner with a mic that will point out a mic to you to ask the question. And then I have to put on these earphones and listen to Melody and find out what you're saying. So it will give us some more time for you to think about questions, okay? So, as Fernanda mentioned, I live in British Columbia, Canada. Where I live is I have a farm in the central aspect of British Columbia, and we grow grapes and also cattle. This is not my piece of property, but I would like to have something very similar to this. And my grapes are baby grapes still. They're only 2 years old, so they have a little ways to grow. So we're off and running. So here we have basically an adult dog, and we have a picture of the lower mandibular molar and second molar, and also the third premolar. What do you see on this picture? Just quickly raise your hand if you think this is normal, abnormal. If it's abnormal, what do you think is abnormal on this? Everybody says it's normal. Is that correct? You all fail. Okay? What do you think is abnormal here? Don't be afraid. This is how we learn. Okay, first daredevil.
Acho que o dente está sendo reabsorvido.
So we think it's going reabsorption. Is it because of this right here?
Não, parece que ele está diminuído e tendo desgaste.
So you're absolutely correct that the tooth is shorter than normal, and there is some wear. Very good. So we see some wear here. Now the next question I have for you then is, how deep is that wear? Is it through the enamel? Is there dentin exposed? Is the dentin worn out and we have pulpal exposure? You must be thinking of this when you see this. Anybody? You have A, B, or C. So you pick A, B, C. So 33% chance of success by guessing. Anyone? So the question is X-ray. Well, X-ray is one reason that way, but you can also tell on your clinical exam. How can you tell on your clinical exam? Very good. You can see the pulp normally. Or, better yet, you can get an Explorer, one of the periodontal probe tools, that has a very sharp little point, and put it into what you think is the pulp. If you can get in, you can say, yes, there's pulpal exposure. But sometimes dirt in that obliterate that pulp if it's really an old lesion. And that's where your radiograph will be very essential. Okay, so, okay, one, that's pulp. How about dentin versus enamel? Here, is there enamel gone or is there still enamel? Who says there's still enamel on top of the tooth? Raise your hand, please. Okay, a couple people. If you look carefully at the tooth, you should be able to see a different color change between enamel and dentin. Enamel is pure white. Dentin is that yellowy color. So now looking at this, who says there's dentin exposed? Only 2 people, 3 people, okay. Yes, you're right. So there is dental exposure. Now, is there something we should be doing with this if there's dentin exposed? I see a few heads going up and down. Yes, that's correct. Remember, Dr. Lopez mentioned that the dentin has tubules. These tubules radiate from the pulp up to basically and into the enamel, just into the enamel, not all the way through, but into it. So if we have wear of the enamel into the dentin, basically those odontoblastic tubules are open. And bacteria can get in there and invade into the pulp and get infection. So these can cause problems later on endodontically. So what we do is we acid etch and put sealants on these teeth to protect them at a minimum. I'm sure you see these every single day in practice. And if you're not doing anything, you're throwing away, one, money, but more importantly, you're not addressing the animal's health. You're not doing your job. Shame on you. Okay? Bring it to the owner's attention. Okay, enough with that tooth. How about the gums? Is there anything wrong with the gums here? Okay, everybody's nodding. What is wrong with the gums? There's gingival recession. I have a hard time appreciating that, looking at this. The only way you could find out would be if you had pocket would be a periodontal probe. But looking at that is right at, the gums are right at the segmental enamel junction, so that would be where they're supposed to be. But what else is going on with these gums? The question is, there might be hyperplasia. There's minimal gingival hyperplasia, I would agree with that, because there's basically, instead of the sharp edge of the gingiva next to the tooth, it's a little rounded edge. Does everybody see that? So as a result, we have gingival inflammation. Okay? Let's take a look at the x-rays. There we go. So here we have the x-rays of that tooth. So as we suspected, there's no pulpal exposure here. There's quite a bit of dentin, but the enamel is worn off up here. So we do have to protect that. The endodontic system all looks normal. The apex looks normal. So does here. But now we're looking at the gums and the bone around the tooth. Is that normal? Gums are hard to appreciate because on x-ray you can have a hard time seeing, but we can see bone quite readily. Is the bone normal here? Yes, it's normal, or no, it's not normal. I say, I'm asking no because it's not normal, because then all the shy people won't put up their hand, so they'll get it right. That's true. It's not normal. So what you want to do when you ever take a dental x-ray is look at the crustal bone height. Now that crestal bone height should be just below the cemental enamel junction here, so about right where this pointer is. So is there bone loss? Yes. So there is some beginning bone loss. It's not a lot, but it is beginning. This is where your benefit, your expertise will be actually most beneficial to the patient and to the client, because this is easy home care to control this. As a result, this is where you could maximize the benefit of a health package for this patient. So here we have some bone loss, and as a result, what we have is grade 2 periodontal disease. So what we want to do with that is do your oral hygiene, do a little bit of subgingival curettage, so cleaning beneath the gum line, root plating a bit, especially at this area here. So some root plating just to clean that root so we can get maybe some reattachment of the gums onto the tooth. And then create a good oral home care program. That home care program has to meet not just the patient's needs, but the client's needs as well. Do you know what I mean by asking about what the client's needs are? Who doesn't know? You know, so I don't need to talk about it? Or do you need to know? Okay, some people are saying we want to hear about it. What the patient or the owner's needs are, let's say they're a salesperson and they're going town to town. Do they have time to brush their pet's teeth every day? No. So there's other ways of controlling dental disease or periodontal disease than just brushing the teeth. A lot of these products, unfortunately, may not be available in Brazil, but in North America, we have the benefit of having them available. And hopefully soon, some of these products will be available here, such as water additives. You can put chemicals in the water, natural products, I might add, no chemicals, that actually reduce the amount of plaque and calculus on the dentition by over 67%. That's very significant. There's dental diets that are available. I know you had some before. These dental diets reduce plaque and calculus by 87%. Extremely significant. And the list goes on. There's many gels, water additives, there's gel caps, other types of products powders you can put in the food, all these types of things that help. You have to look at the data of these products in detail to see what their benefits are. Okay, next one. So here we have a dog with its maxilla showing its incisors and canines. What do we see here? I'm not going to help you on this one.
Retração da gengiva?
So one of the questions is, or one of the comments is gingival retraction, and I agree, right here is subgingival retraction. You're correct. What else? There's a lot more. Just put up your hand.
Hipoplasia ou hipocalcificação do esmalte?
There's definitely gingival hyperplasia or swelling of the gingiva. Calcification of the enamel, I don't see that until we get that calculus off, which I told you the answer of there. Basically, once that's off, we could then say yes or no. Okay, so you're not necessarily wrong, but I can't see it because it would be hidden underneath the calculus, okay? So there's calculus. If there's calculus, there's also plaque, right? So is there a lot of plaque or a little plaque? A little? Who says a lot? Okay, most of you, you're correct. Okay? So there is a lot of plaque there. Wherever you have calculus, you will have plaque. Okay? So, but why do you think that there's so much plaque in calculus here? I understood Portuguese. Do you know what happened? Let me... Do you know what's happening with the... Technical difficulties. Thank you. So one of the comments was there is a malocclusion. You're absolutely correct. Because of the malocclusion is predisposing the animal to develop more plaque retention and subsequently calculus formation and causing more release of inflammatory byproducts, which causes inflammation. So here we are. This tooth here is maloccluded. So this is what we call a type 1 malocclusion. And basically it's just like rotated teeth. They have to fit in someplace. This is overcrowding of teeth that has caused this. So they have to fit in someplace, and when they get overcrowded, that encourages plaque retention. Okay? Let's take a look at the x-ray. I want you to look at this very carefully from one end to the next. Look at the crestal bone height. Look at the relationship of the bone to the cemental enamel junction. And then look at the tooth itself and tell me if you think there's anything wrong here. Don't be shy. It's all normal. I go to the next one.
Está tendo necrose da raiz.
The comment is there's some necrosis of the root. There looks like it here, but actually it's not. It's just that the bone here is very thick, and you can see a round area up here. I know you're going to say I'm on drugs, but I'm not. Basically, the root actually is okay. The only reason I can say that 100% is we took other radiographs at different angles. But it's good that you observed that. So is there bone loss? Yes, there's bone loss. Look at the crestal bone here. It should be right up here. Okay, so there is some significant bone loss here. And I don't mean a little bit, a lot. There's a lot of bone loss here. But there's even one more thing that actually you shouldn't have missed. It's a very, very big and important thing. And if you miss this, you would be, it would not be good for the health of the animal. I'm going to give you a hint. when I checked for mobility of the teeth, one of the teeth actually had quite a bit of mobility. So it moved quite a bit. Any idea? Extra points if you get it.
Teve a
Existe
destruição
cisto
do,
ali?
Peraí, desculpa, ele estava
a
falando.
destruição do ligamento periodontal?
Não vi.
The answer was there's destruction of the periodontal ligament. Whenever you have an old animal, and this is an old animal, how do we know that? Because of the width of the pulp. The pulp is hair thin. That means that this is an older animal, so the periodontal ligament is naturally going to be very thin. But we do have a periodontal ligament around all the roots. So I don't feel that that's right. Question other.
Existe cisto ali na parte superior da imagem?
The question is there a cyst here? Those are not cysts. What do you think? This is the maxilla. So that's a foramina where the sensory organs of the volar process come in. Okay? So this is how, sorry.
Reabsorção óssea.
Well, there's bone reabsorption from the crestal bone from periodontal disease. That's correct. But that's, we've already talked about that. Okay, I am going to get one more answer before we move on, and I'll show you why. One more comment from one other person. There's dental reabsorption. I don't think so. Okay. So I'm going to tell you the answer, and you're going to kick yourself when I tell you. Look at the third premolar on your left side. Not premolar, incisor, sorry. What is this? That's a fractured tooth. You can see clearly the fracture line. Right? Remember I said there's mobility to that to one of those teeth? Well, that's the tooth that was mobile. It had a crown fracture. Okay? So they can be sometimes very subtle. And you can see that since it's near the crestal bone line, it can be very difficult and confusing sometimes to see those little intricate details. But that's why you have to amalgamate your clinical findings with your radiographic findings in order to get the proper answer. Okay? So if you remembered that you've got mobility on that one tooth, well, you would keep looking as to why is it so mobile? And you would have found that. I know all of you would have. So we have grade 3 periodontal disease, root fracture, and there is some ankylosis at the tip of the roots down here, but not very much. Just the beginning of ankylosis. So ankylosis is fusion of the bone to the tooth. And that's usually due to chronic irritation. So here we have a maxilla of a dog showing the, excuse me, here's our third premolar, fourth premolar, second molar. So what do you see here? Does it look pretty good? Okay, come on. Everybody needs to know one answer here. I mean, this one, you can see something very clearly. Is it nice and white, or is it not white? Is it enamel supposed to be white? Okay, I'm going to start, if you don't answer, I'm going to start picking out people.
Doença periodontal?
Yes, there's periodontal disease. So when you say periodontal disease, why do you say that?
Por causa do tártaro, da cálculos, yes.
Because there's calculus.
Yes, that you ask.
There's calculus and there's plaque, absolutely. So there's periodontal disease. So do you think this is bad periodontal disease or not? Okay, so we have full coverage of the crown with plaque and calculus. Does that mean that there's significant periodontal disease beneath the gum line or not? Yes? No?
Yes.
Okay, yes. Well, the answer is it could be. So I won't say yes. You could have tons of calculus and plaque here, and yet the gums and bone around can be very good because the body's ability to control inflammation, which causes the bone loss, causes the tissue loss, is good. So it depends on the immune status of the animal. And also, is it getting other products to aid in that prevention of that tissue loss, where then you would just get this calculus and plaque, and nothing wrong. So, we also have a missing tooth, right? Correct? Okay, so the first molar is missing. Here's our x-ray. Remember, look at your crestal bone height. Look at the roots, the crown of the teeth. Normal? No, of course. So what is abnormal? Why does it look abnormal? Even if you describe the lesion, I'd be happy. Because in these days of technology, you could even email me this x-ray and we can have an answer back in a few minutes. So even if you don't know, you can find out as long as you can recognize that there's pathology there. So just even if you recognize that there's pathology, wonderful. That's even more important than, say, knowing what the disease is, because you recognize it, you don't miss it. So what pathology is missing?
A raiz esquerda está menor e tem espaço entre o dente e o osso.
So the left root up the fourth premolar, right, this one here, is that what you're saying? Is smaller. That is normal, okay? That's the palatal root. The palatal root is always shorter than the mesial root on that one tooth, okay? Now there is a big space from here, the crestal bone, to where the cemental enamel junction is. So you're correct. So we have, here, look where our crestal bone is. So there's a huge defect. And it's located in the furcation area. The furcation area, the area between the roots. Okay? So with furcation involvement, that's the first area that we see bone loss. Okay, I'm just going to go back a few slides to show you the first x-ray. So on this first x-ray, you can see a little bit of bone loss here and here. That's when you take x-rays and look at teeth that have multi-rooted teeth, that's the first area you should look for lucency, because that's the first area that we will have advanced bone loss. Because plaque retention is so rampant there, and it's harder for animals to get that area clean. So that's usually where we see the bone loss first. Let's go back to the current case. So here, would I be able to get my periodontal probe down to the bottom there? Who says yes? Yeah, you should be able to get your periodontal probe down there, and you should have a very significant pocket depth. Okay? So there's advanced periodontal disease here. So what do we have? We have grade 4 periodontal disease, and obviously this first molar is missing. So you can see from the picture, sometimes it can be very deceiving that it looks pretty good until you take that radiograph, or I should say, and when you clinically probe the area. So just remember that your clinical evaluation is just as important as your radiographic evaluation. Oops, sorry. Okay, the next one. Mandible of a dog, the rostral aspect of the mandible. Are all the teeth there? No. So there's some missing teeth, right? So are all the canines there? Well, you can't see the upper canines, so I can't say you got all the canines, but the lower canines, are they there? Yes, they are. So the teeth that are missing are incisors, okay? So how about, is there plaque and calculus? Who says yes? Wonderful. There's no plaque or calculus.
Seems to have a very little calculus around the neck. Very little.
The question is, there's very little calculus around the neck. Well, I'm going to tell you there's no calculus or plaque around the neck. But this has very significant problems. Okay, we have the right canine and the left canine. Okay? Are they the same size and shape? Shape, I would say probably yes. How about the size? No, the size is not correct. One is not as big as the other, correct? Okay, let's look at the x-ray. This is a very involved x-ray. So there's a lot of pathology here, a lot. So if you're taking x-rays, it behooves you to do a thorough evaluation of it, not just take it and charge for it, but really analyze it. And this is something that takes time to look at and appreciate. You should be able to recognize that it's not normal, and that if you don't know what it is, ask somebody. Could be your colleague down the road, could be Dr. Lopez, could be somebody like me, the list goes on. So what do we have here? What is some of the pathology we see? Obviously, then the missing teeth, okay?
Agenesia e hiperplasia.
Well, it's agenesis. Agenesis means you're born without teeth. This could have been from periodontal disease, so I can't say it's that. But we have what we refer to as oleodontia. Oleodontia means there are some missing teeth, okay? We don't know what the cause is, but there are some missing teeth. Now, you said some gingival hyperplasia. I'm going to say that there isn't. But you have something very, very close to that, which we will address very soon.
Eu tenho uma perda da massa óssea?
The question is there bone loss? Yes, there is. The bone loss is right here. So here on this incisor, you can see a crestal bone here should be up here. So there's some horizontal bone loss from periodontal disease. But there's more, and even more significant than that. Okay, I'm going to make this one easy for you.
James.
Oh, question, sorry.
Bem próximo à raiz, ela tem muita destruição óssea também. Não na raiz, lateral a ela.
So are you talking about this tooth here? Or here?
Caninos.
On the canines. You're absolutely correct. But it's not bone loss. What it is an infra-bony pocket. Now, infra-bony pocket means that the crustal bone, the top of the bone, has actually been, basically has a deep periodontal pocket. And yes, there is here. But normally, that crustal bone should be 1 millimeter below the cemental enamel junction. So let's look at this canine. Here's the cemental enamel junction here. Here's the crustal bone. Is that 1 millimeter below? No. The crustal bone is above. So what would cause that? Is it a miracle that it's happened this way or what? What happens when a tooth... sorry, question.
Tem cisto mais para baixo. Tem inflamação bacteriana.
Well, there's in the infrabony pocket, there will be inflammation. So yes, you're correct. But that's not the cause of it. Think about when a tooth erupts. Is the crown always above the bone loss, or around the? Is the crown always above the bone? It should be, but when it first erupts, it's not. It's got to go through. So, to put this bluntly, this animal has not erupted to its normal area. So there's an incomplete eruption. And we have a pseudo infrabony pocket, a false bony pocket, okay? So this is leading to advanced periodontal disease. We know that this is not a young animal. Why? Why is this not a young animal?
A espessura da polpa do dente.
Absolutely correct. So the thickness of the pulp. So if we look at it, here we have, look at this wide periodontal ligament here. Yet we have virtually no periodontal ligament here. This wide periodontal ligament should not be wide. It should be very thin. So it means that that tooth is mobile and going to be lost. We see the infrabony pockets here. And the other thing is we see Synthesia Separation. So I could take one side and move it up and down, and the other side is stationary. Now, this is very common when you have lack of dentition around the symphysis. Because if you had, and also if you have bone inflammation, which we do, as a result, we have instability of the jaws. Okay? So you can see this is a very complicated x-ray, but it has lots of things to learn from. So what did we do here? What do you think might be the best way to treat this? And don't say refer to Fernando or I, okay? If you were going to treat this, how would you treat this? Knocking everything over. So, what are you going to say? What are you going to do?
Acho que inicialmente a gente teria que começar estabilizando essa síntese, talvez para ajudar esse animal a comer, principalmente, né?
Well, that would make logical sense, but the answer is no, that's wrong. Let me explain. The first reason, why is it unstable? You have to think of why is it unstable. Remember, the symphysis is not a bony union. Is fibrous tissue, okay? And as a result, in this case, we have significant inflammation in that area. So the first thing that we need to do is to control the inflammation, and if possible, replenish some of the collagen that has been lost. That can be very easily done with different types of products. And disc treatment, removing that incisor, treating the canines. That will significantly reduce the inflammation in the area. As a result, we'll get a much firmer jaw. And that could be sufficient. Now, in some cases, some people will say, wire it. It doesn't really work. If you control the inflammation, you will get a much tougher symphyseal area where you won't need to do further treatment. So controlling the inflammation, doing a good oral hygiene. Do you think that incisor is salvageable, or should we extract it? And why? Who says we should save it? So who says we should extract it? Why should we extract it?
Porque não tem mais sustentação em volta dele.
You're correct. Basically, there's no periodontal ligament. You see how wide it is. Basically, this is very mobile. A very strong wind would probably blow it out. So basically, yes, it should be extracted. Okay, what else should we do? So should we just pull it out and that's it? Okay, when you see a socket with the periodontal ligament so wide, that tells you there's a lot of granulation tissue in there. You need to get that rid of, because that's all inflammation, all bacteria. Oh, sorry. So as a result, we have to curette that socket. Okay, we get that under control. What are we going to do anything with those super bony pockets with the canines? Who says no? Who says yes? And most of you don't know. Hey. Okay, so we're going to treat that because that's an area of inflammation. And we can manually make a huge difference by treating it properly. What we would do is do a periodontal flap, remove this bone around here down to the cemental enamel junction just below on both sides, and then lower the gingiva. So we would do what we call an apical repositioning flap. Okay? That's how you would get good health, in this case, with treatment. And you wouldn't need to do anything else. Okay? Okay, the maxilla. Here we have the canine, the fourth premolar. I don't know what's underneath here. And there's what looks like, maybe a couple crowns or whatever there. I don't know. What do you think is going on here? I guess all normal with everybody answering. I guess I'm going to have to point fingers.
Tem muito cálculo sobre o dente, então não consegue ver o que está abaixo na gengiva.
That's correct. There's a tremendous amount of calculus on these teeth, and it's hard to assess what's underneath it. You may not even have a tooth underneath it. There's what we call calculus bridging. This is calculus bridging. These teeth are stable. There might be 3 teeth there, and they could be all stable and firm, so no mobility. But once you take the calculus off, then the teeth are unstable because of periodontal disease, or it could be that way. So you really don't know until you take an x-ray. Would everybody say that that's the only thing you see here? Who says yes? If you say, so nobody says yes, so other people say that there's other problems. So I'm going to ask a few people what the other problems are.
Tem também hiperplasia gengival sobre o canino.
The comment is there's some gingival hyperplasia of the canine. A little bit, I'll agree with that.
Incisivo ali que está faltando, né?
There's a missing incisor is correct, but I'm asking behind the canine.
Falta dente.
The comment is there's some teeth missing. I'll agree with that.
Era isso mesmo que eu ia falar. Faltam os premolares aí.
Yes, there are premolars potentially missing, but because there's still some what looks like some tooth remnants or crowns here. Okay, I'm going to show you the x-ray. Now what do you say? Since there's so much here, let's take it tooth by tooth. We'll start from the back with this molar here. What do you see on that first molar or that second molar?
Eu acho que está faltando uma raiz nesse segundo molar e...
This root here is loosened, so I wouldn't say they're missing, but rather they have no bone support. So it tells you that that tooth has to go because that root has no bone around it, and that whole tooth will have endodontic disease. You could potentially amputate that root here and then do a root canal on these two roots, but that's very difficult, even for me, okay? I do a lot of root canals, but that one would be very difficult to do. So, do we all agree it should be extracted? No or yes? Okay, so I agree. Extraction is the way to go. Okay, let's go to the next one, the first molar. Oops, sorry. So the first molar right here. As we talked earlier, you can see the calculus bridging across, making it stable. Remove the calculus, it will be extremely mobile. Why? So if I remove the calculus, why is it going to be very mobile?
Absorção óssea e exposição de raiz.
Absolutely. So right here, there's no bone around this root here. You can see the widened periodontal ligament here, so you've got very severe periodontal disease here, where basically just the tip of the root has normal bone, and that's less than about 10% of bone there. So we have 90% bone loss there. So this tooth is an extraction, correct? So we'll take that tooth out as well. Okay, so the fourth premolar, this one here. How about that? What do we see there?
Ele está com a reabsorção óssea mais exposição de furca?
Yes, correct. So there's bone reabsorption, and the furcation is exposed. So you can see the bone here, and the loss of bone with the furcation, and a lot of bone. And when we look at this, we look at how much bone loss do we have. So the tip of the root is right about here, and here's the crustal bone. So how much bone do we have lost? About 50%, right? So I'm just going to give you a rule of thumb here. If you have bone loss between 0 to, say, 25%, every single one of you can treat this. Okay, just with some simple root planing and some gingival curettage, it will be fine. Between 25 and 50%, then I would say you need to go and refer this to more advanced individuals that do a lot of dentistry. If you do a lot of dentistry, you're the types of people that we should be doing this. And you can get good success. From 25 to 75% bone loss, you can save that, but it's heroics. Okay, so it's very, very difficult to save. If you have more than 75% bone loss, it's lost. You extract. Okay, so that's a rule of thumb for all of you. So here, we could potentially save this, but we're going to have somebody that's willing to do advanced periodontal disease home care. And those people are few and far between. As a result, it might be in the best interest of the dog to extract that tooth. But before you extract, it always behooves you to talk to the owner to see if they can do that type of home care. If they can and want to try and save the tooth. To save that tooth, we would need to do a flap, a periodontal flap, to expose the roots, clean all the roots, and then make sure the bone is nice and smooth there, and do an apical repositioning flap. So they can do home care in that area. Okay? Next, we mentioned that we had some missing premolars. We actually do. We have the 6 and the 7 missing, which means the second premolar and third premolar are missing. Does everybody agree with me? So does everybody agree?
Yes.
Well, why? Isn't this a premolar? It has 2 roots.
É descido.
It's a deciduous tooth, correct. Why do you say it's a deciduous tooth?
É dente pequeno com raízes curtas e está começando a ser reabsorvido também.
So the answer is, I agree with most of what you say, not 100%. So it's smaller, absolutely. Small roots, most deciduous teeth have long roots, long, thin roots. And if you look here, we have a very long, thin root right here. Now, yes, some of it's going under reabsorption, but a lot of times they'll have long, thin roots, unless they're going under reabsorption. So short roots doesn't mean it's deciduous, okay? So here we have a deciduous tooth. If it's stable, no periodontal disease, I would leave it. So we might be able to save that one, maybe. It depends on your clinical evaluation, whether you have periodontal pockets, a lot of inflammation in that area, or what. Okay, here we have 2 first premolars, supernumerary teeth. We have a little bit of crustal bone loss here, but not very much.
Qual que é o objetivo de salvar dente descido?
Good question. Why should we save a deciduous tooth? The reasons to save a deciduous tooth is if it had an adult underneath, then I wouldn't save it. But if there's no adult, such as in this case, and it's still functional, I'd rather keep the function. A deciduous tooth can still be functional, even if it's just a deciduous tooth. So if you had no canine except for the deciduous canine, I would leave the canine, deciduous canine, because it's still functional. It can grasp, maybe not as good as the adult tooth, like the adult dentition, but it still can be functional. That's why I would leave it. Now, in this case, with these 2 supernumerary teeth, I'm going to extract one. And the only reason I'm going to say extract it instead of save it is due to the closeness here. This area right here is going to accumulate a lot of plaque and calculus, and we'll get advanced periodontal disease. So I would take that out to actually enhance periodontal health. Now the question now I have for you is, which one would I take out? The first one or the second? Okay, I'm going to ask all of you, who would take out the first one? Raise your hand. So about half. So the other half would take out the second. I am going to say I would take out the first one. The reason why is because it's close to the canine. It has the same amount of bone loss as the one distally, and as a result, that by taking that out, I'm going to enhance the periodontal health around that one I will retain. Where if I left that, I took out the second and left the first, the area between the first premolar and the canine could accumulate quite a bit of inflammation. And for that reason, I would take that one out. Okay? Any other questions on this case? So here we have grade 4 periodontal disease, supernumerary teeth or extra teeth, a retained deciduous tooth, and missing teeth or oleodontia.
James, one question here.
Se eu fosse tentar extrair qualquer desses premolares, provavelmente o do lado sairia junto com essa doença. Como o senhor faz? Porque eles estão muito juntos, né?
I'm sorry, I didn't get the question completely. If you could repeat it again, please. Are you talking about the supernumerary premolars? Okay. If you take out the first premolar, the second premolar, even though there has been some bone loss, it still can be healthy. The bone loss is less than 25%. As a result, they can still have many, many good years left. So, but if you left the first premolar and took out that second supernumerary premolar, the area between the canine and the first premolar, the diastamal space, is very narrow. And as a result, can accumulate a lot of plaque and calculus, encouraging periodontal disease. And then maybe down the road, you might have to take that out. That's the reason I would take that first one out, but not the second. Does that answer your question? Okay, now I understand the question. Sorry. When you do your extraction technique, the first thing I would do in this case is take a number 11 scalpel blade and cut right into the periodontal ligament around the tooth I'm going to extract. Right then, that gives me a little area for my small, and I repeat, small elevators to get into, so it gives me a pathway of insertion into the periodontal ligament space. And then, all what I'm doing is what we call the wedge technique of extraction. So in other words, I'm not putting any pressure or leverage against the other tooth. All what I'm doing is expanding the bone, the wall of the bone around the tooth in question to create mobility. I should be able to create enough mobility to like a grade 3 mobility where we're really moving that tooth that we could grab with a pair of forceps and pull it out without even putting any pressure on that other premolar. Does that answer your question now?
Na minha falta de prática, eu não conseguiria extrair um dente extranumerário sem abalar a estrutura do vizinho. Mas eu já entendi o que o senhor quis dizer.
Okay. What I described is actually very, very simple. It's a basic technique that we teach our second-year students at university, but just using that scalpel blade, not a number 15, but a number 11, and cutting all around. It makes a world of difference. Just that little tidbit is worth you attending this whole conference, because that will make your life so much easier, and also your patient's life a lot easier from lack of iatrogenic trauma. Because that little knife allows a pathway for your elevator to get in. And when I say your elevator, I'm talking about just putting your elevator into that pathway, and then if the tooth is just right where my microphone is, then just rotating it and holding it there, stretching the periodontal ligaments both ways. That's every veterinarian here should be able to do that. Okay? That's a very simple technique. When we have to do the wheel and axle procedures and that for elevation, that's more advanced and can have complications, like what you've said. However, the one I just mentioned is a basic fundamental principle of extraction for any extraction. We use that with every single extraction, that technique. Okay? Any other questions?
Com a extração dos molares, os pré-molares, eles não vão se ajustar nesse espaço?
Would you extract in humans? The answer is yes. In animals, like carnivores, no. Just because the occlusive forces are not there. And as a result, basically, they will not move. At first, I thought exactly what you said would be happening, but it's not true. And that's after 34 years of dental practice. So don't worry about that. Any other questions on this case before we move on? Okay. This is where I live, and this is one of my hay fields, and this is some of the parasites that eat my hay. They're called elk. They every year they eat about 60% of my hay crop, which gets very costly. So we like to shoot them and eat them. They're very good tasting, probably the best meat around. I know your meat is excellent here, but nothing like elk. Okay, so we're going to look at these teeth right here. So here we look like there's quite a bit of calculus. There's a lot of plaque. There's a calculus bridge here. The reason I'm mentioning this is we already learned this, okay? So I'm trying to maximize your time. Does anybody see anything else other than maybe some missing teeth in here? The gums, it's hard to assess because there's so much calculus, right? Okay, let's look at the x-ray. Oh. What am I doing? Now what do you see?
Temos bastante perda óssea. Em volta
Correct.
da raiz distal do primeiro molar tem um abscesso periapical.
So, yes, there's a tremendous amount of bone loss, but not just with that first molar, but all the teeth here. Oops. Yeah. What did I do? I'm pressing wrong buttons. I'm sorry. So, here's our crestal bone. So we have a lot of bone loss here. We have furcation involvement here. Here's our cemental enamel junction. So we got about 50% bone loss here. Here we got more than 50%. We've got about 60 to 70% bone loss. And then we have bone loss at the furcation that goes apically to where basically there's a wide area here. So this is an abscess. Now the big question is whether or not the alveolar canal is exposed or not. And that's really important to know when you do an extraction. Why? Why should we be concerned about that? Okay, let's get some answers from around this area. It saves me from running to the back.
Vergonha. Acredito que na hora da extração você pode traumatizar o nervo alveolar inferior. E também porque boa parte da mandíbula, da altura da mandíbula já foi comprometida. Talvez 50% da altura da mandíbula na região da raiz distal foi comprometida. E você pode ter uma fratura patológica. Acredito que não pela extração da raiz distal, mas eventualmente por fazer alavanca na raiz mesial e, eventualmente, depois na vida desse animal também. Não sei, talvez isso.
I don't have to say anymore. A few things. I always have to add more. I lied the first time. So you're absolutely correct. Basically, you have probably the infraorbital, or not infraorbital, the alveolar canal exposed. Now, when you do an extraction here, you have to granulate that. There's the granulation tissue in there that you must get out to cure and get rid of the infection. By curetting, you could curette the alveolar artery and vein, having lots of blood squirt out. Never mind traumatizing the alveolar nerve. So you have to be very, very careful here when you extract. So in this tooth, if you're going to extract, which I would section this tooth right here and create two teeth. This one should be easy to pull out because you know radiographically it's got nothing in there. The area that we have to be concerned about in that area is when we're curetting that alveolar socket, not to traumatize the artery, nerve, or vein. The mesial root here is much more difficult. The normal aspect is we would pull this way. And if you pulled that way, you would fracture the jaw. Simple as that. Because this area would put pressure on this area right here to fracture. So this is where, if you did not have x-rays, you would fracture the jaw in normal conditions by just pulling that the wrong way. We now know because of this curve here, we would have to pull this way. So caudally, inside the mouth. So it's a little bit more difficult. But that's how you would avoid iatrogenically breaking the jaw. Okay? So x-rays tell you how you can do your treatment plan.
No ramo da mandíbula, abaixo da furca, tem aparentemente parece ter ou um artefato, uma sobreposição ou uma fissura no ramo.
So are you saying the branch of the nerve or the branch of the tooth or bone?
O osso.
So, if there's, you could say that some could say there might be a fissure, like a crack here. I don't think so. And in this case, would be which area here? Fernanda, could you?
Behind the mesial root? No. Aqui? This.
That would be artifact of hair. Because if you look at it here, look out here, you see that artifact continue. So it's just hair. Okay? Good that you noticed, but you just have to follow it down and then look beyond, and you can see that it was easily hair. Okay? So here, we would take this out, clean this out, and yet there's a lot of bone that can be saved where we don't have to basically do a mandibulectomy or something like that. It makes life a lot easier. We could save this last molar, just maybe less than 20% bone loss, so we could save it, but really if they're not going to do home care, why would we want to save it? It would be better to extract, okay? So we have what we call a perioendolesion, which means that it started off with periodontal disease, went to the apex of the tooth, infected the pulp inside here, and that's why we call it a perioendal lesion. This would be a perioendal lesion class 1, to be more specific. You don't need to know that. Just know that it's both periodontal disease and endodontic disease. Oleodontia, we are missing some teeth here, and that's it. I know I have a number of other cases, but I'm told that I'm over time, so I guess I have to stop now. Is that right, Carla? So what I would like to do is I'd like to thank you for your participation. I hope you enjoyed this as much as I've enjoyed giving it to you. I think I've lost a few pounds with sweating, running up and down the stairs, but I've had a lot of fun. Good luck. Thank you. Sorry, there's one question. The question is, could we save the tooth if we put bone grafts and that in here, guided tissue regeneration? On this one, yes. On this one, no. For a few reasons. If we did a bone graft here, we'd have to do a root canal in this tooth first. Second of all, if we clean this area out and put bone in here, we would get ankylosis. So it would be possible to save it. It would be pure heroics. And it would, in North America, that would be about a $5,000 case for one tooth.
James, the question is, after you extract this tooth, if you would use bone grafting just to strengthen the mandible or not. A pergunta é, se fazendo a extração, após a extração, se seria colocado enxerto ósseo para fortalecer, dar um pouco mais de estrutura para a mandíbula.
The question is, so if we took that bone or took the tooth out, the concern is maybe the jaw's weaker. And yes, it is a bit weaker. And whether or not we would put artificial bone in there for the body to fuse and get new bone formation to strengthen the jaw. That is a great idea, but I would say I would be cautionary in this case to do that. The reason why is because on the distal root of the molar here, I would probably have to leave some of the granulation tissue near the on the alveolar artery, nerve, and vein. And as a result, that could be enough to cause failure of bone grafts. What you could do is remove everything you could, let it heal, and come back a few months later. That would work, and then put artificial bone in there, and that would strengthen the jaw. So yes, you can do it. So when you put artificial bone in, never, never, never put it into a contaminated site. Always make sure it's a clean site. Now remember, I didn't say sterile, I said clean. So you clean it out, because you'll never get a sterile area in the oral cavity. It will be clean, okay? Does that answer the question?
Thank you very much. I think it was very, very nice for us to have you. I'm sorry for the heat. I don't know why. The air conditioner is not working. We will ask what's going on. But muito obrigado, gente. Que vocês tenham um bom domingo. Tem um restinho de carnaval aí em todo São Paulo para vocês aproveitarem. E a gente se vê de novo. Quando vai ser, Lu, a próxima? Lu? A próxima é em maio. Maio, que dia? Dia 7 de maio nós vamos ter o próximo VetCare, a gente avisa com antecedência. Obrigada e bom domingo a todos.